Miami is one of the largest and fastest growing metropolitan areas in the United States. It's home to more than 500,000 people without health insurance, and that number grows each year. The city is fed by a network of agricultural communities which are home to thousands of migrant farm workers. Often, undocumented workers have little money, no health insurance, and nowhere to turn for medical care. But one free clinic in Homestead, Florida, opens their arms to those men and women to provide the care so desperately needed. I'm Dr. Richard Meyer, and right now we're at Good News Care Center to highlight the great work this free clinic is doing to change and save lives. We met with the nonprofit's founder, Michael Daly, to learn about the clinic's history and the services they provide.
This clinic actually grew out of doing a combination of health fair and dental projects. Back in 1988, I discovered that there's 3 huge migrant farm worker camps here in South Dade, and decided to do the dental projects there. Somebody had recommended to me that we might consider doing health fairs while we're in the migrant camps because of the need for medical care that might be of great benefit to the residents. And we got together and strategized, planned out a health fair to do in the evenings with the migrant farm workers after they returned from their work, and promoted that in the camps, going door to door to let people know we were coming. Some of the most essential services that we are able to provide our patients are access to primary care health care, health education, specialty care, and also hospitalization care through the hospitals of Baptist Health South Florida.
Primary care physician access is the cornerstone of what Good News provides, and for more than 16 years, Dr. Leonard Goldberg has done so here.
Good News Care Center cares. The caring is important. Everything runs through a theory that the patient is the center of everything, and they want them to get better. It's a one-on-one relationship. Your patient is yours. I have no time constraints. I don't have to worry about the finances of the thing. All I worry about is the patient. Let them talk as much as they want. I'm in no hurry to get through with them, and it's enjoyable. This is the way I like to practice medicine.
Preventative care education is one of the most essential services the clinic provides, and certified diabetes educator, Nurse Matilda Lewis, has provided it here for 15 years.
Teaching them about the actual complications. I think they have many myths, and they think that a lot of what we're telling them, oh, it's not going to happen to me, oh, it's not real. So just teaching them, we have on the wall real pictures of things that they could see that could happen if they don't bring down their numbers. What are their foods of their countries, of their cultures, trying to work within what's in their means and what they actually like and eat. Just empowerment, showing them the numbers, trying to teach them what it means, your blood sugar in the fasting state, and then what it is 2 hours after a meal, so that they can see the relationship between what I ate and what it did to my blood sugar.
The network of specialists that donate care through Good News is an incredible resource to patients, like Dr. Eufemiano Cardozo, a hand surgeon who has been with Good News Care Center for more than 19 years.
They don't have any other help. But there are other patients who we get who have no insurance, and people who are in bad health state, and a lot of them have got lots and lots of problems. Ulcers, with hand problems, joint problems. So now, right now, I see patients that having some lumps and bumps and some cysts, some abscesses. They come, finger problems, hand problems, carpal tunnel syndrome, trigger fingers. I help them to take care of their problems. Good News Care Center is a well-organized place, and people like to come to our place because we are treating people with compassion and humility. And I like to come here because it gives me peace. And since last now 19 years, I'm still coming here, and I want to continue coming here till I can work.
The clinic's support from Baptist Health South Florida allows for access to the nation's leading laboratory, pharmacy, and imaging services.
The commitment of Baptist Hospital committing themselves to providing laboratory services, radiology, pharmaceuticals, that would not be possible if we didn't have this commitment from Baptist Health South Florida and Baptist Hospital.
In addition to receiving primary and specialty physician services, patients may get their blood drawn in the clinic, which is processed by Baptist Health's laboratory, and receive their medication on site, which are donated by the Baptist Health Pharmacy. In addition to providing thousands of patients with quality care, Good News also develops the next generation of providers, like nurse Augusta Momodu, who trained here.
I had the opportunity to do my clinical community service with Good News Clinic, where I met Anna. And I had a very great experience here, caring for the less privileged and the entire community who has no fund of caring for their health. Most of them come here and we follow those cases till they get better. And to me, that was a very great experience for me because I like to render help for those who really needs it.
And when Augusta's sister, Mary Imolele, was found to have cancer, she knew exactly where to turn.
I had a lump on my breast. Went further for MRI. Before then, we had spent like close to $5,000, you know. I wasn't working because I just came to the United States. Then funding was a problem. So we're praying, we didn't know what to do, but she met with Anna at Good News Clinic. She took it up from there and she referred me to Baptist Health, Miami Cancer Institute. From there I met with the breast surgeon, saw the oncologist, they placed me on chemotherapy. Today, I ended the 8 cycles of chemotherapy. Without the Good News clinic, would have been disastrous. Nowhere to go, nobody to turn to because I don't know anybody and I'm not working. I just moved in as an immigrant. I'm not entitled to anything, to insurance or anything. Only God knows what would have happened to me by now because all hope was lost. I didn't have anywhere to turn to. I didn't have any money. I wasn't working. I just migrated. So if not for Good News Clinic and Anna in particular, it would have been another story and that very devastating for me.
If not for Good News, I don't know what would have been the life of my sister. Good News gave her a second chance. They're a life savior, and I thank them so much. I cannot thank them enough.
Imagine being new to a country, not knowing the language, and facing a life or death medical emergency. Patient Oscar Centeno Correa shares how Good News kept him alive.
Yo soy de Venezuela. A los 2 meses estando acá en Estados Unidos, enfermé. Recurrí al hospital Baptist por emergencia y determinaron que tenía aparentemente una colitis. Me enviaron a mi casa ese mismo día con un tratamiento de antibióticos y pastillas para el dolor. Alrededor de los 5 días el dolor fue incrementándose. Recurrí nuevamente al hospital, fui al hospital otra vez y determinaron de que tenía una trombosis a nivel del intestino delgado y a nivel del hígado, por lo cual me dejaron hospitalizado alrededor de 15 días. Efectivamente me dan de alta con un tratamiento que es anticoagulante. Aproximadamente a los 5 días nuevamente vuelve el dolor, pero más fuerte todavía. Fue un dolor ya que era insoportable. Me voy nuevamente al hospital y me ve el cirujano y me dice que lamentablemente hay que operarme de emergencia ese día porque se había perforado el intestino. Luego me entero que me habían quitado alrededor de 15 centímetros de intestino delgado y me habían colocado una ileostomy. Fui a cuidados intensivos. Ahí estuve aproximadamente unos 14, 15 días bajo una sedación fuerte ya que estaba entubado. Me dieron de alta y vine a la clínica Good News donde me atendió la doctora y me dijo que estaba muy deshidratado, una deshidratación muy fuerte, estaba muy pálido y me faltaba muchísimo el oxígeno. Es por lo que ella determina ese mismo día remitirme nuevamente al hospital. Salí del hospital en esos 15 días muy recuperado otra vez, hasta que la señora Ana, de acá de Good News, se comunica con el doctor Ruiz, el cirujano, me examinó y para ver si se me podía hacer el reverso de la ileostomy. Durante ese perdí alrededor de 100 libras, gracias a Dios y aquí a la clínica Good News, que me atendieron excelente, ya he podido recuperarme muchísimo mejor.
Those are just two of countless patients who attribute their lives saved and health restored thanks to Good News Care Center. This community has a growing need for quality care, health education, and medication. And you can answer that call right now by going to goodnewscares.org to find out how you can get involved.
Good news saves lives. Support them and you will too.